Greetings, this is Dr. Angela with another soundbite from the Lifestyle MD. Today we're going to talk about something that could quite literally save your life. We talked about this on our recent walk with the doc this Saturday, and this topic was colon cancer. It is one of the most preventable cancers we have, yet many people avoid screening because they think that their only option is colonoscopy. Or they put it off because it's just too much effort or they just don't want to deal with it. I had a conversation with one of my patients at the walk about how he's putting it off. He's well overdue. There are more options now for screening for colon cancer. I'm going to spend a little bit of time talking about what those options are and how to weigh the pros and cons and how to choose. Why should you screen for colon cancer? Colon cancer is the second leading cause of cancer death in the United States. Screening helps prevent cancer by detecting polyps. Other forms of screening picking up on cancerous DNA. Screening now begins at the age of 45 for average risk adults. I repeat, average risk adults. Who is not average risk? People who have a strong family history of colon cancer, who have conditions or health problems, or have genetic predisposition to having colon cancer. Most colon cancers start off as polyps and they grow slowly over 10 to 15 years. When we screen with colonoscopy, we're not just detecting cancer, we're also preventing it. The objective is to pick up on those things before they progress to stage 2, 3, 4, before they become metastatic, before they go beyond the colon itself. So let's be clear. Colonoscopy is still the gold standard. It detects cancer and polyps. Polyps are then removed immediately. And if you have a benign colonoscopy, you repeat it every 10 years. Then, depending on other findings and the number of polyps and types of polyps, if they're found, it may need to be done every 3, every 5, or 7. It depends on what the findings of the colonoscopy are. You will know when it's done. There is prep required. It does require sedation. So those are 3 cons. So the prep is usually the thing that scares most people away. Nonetheless, colonoscopy remains the gold standard because it can both detect and remove polyps before it turns to cancer. If you have a positive colon cancer screen by any of the other means that I'm going to discuss, the next step is going to be a colonoscopy. So many people still avoid this because they don't want to have a colonoscopy. If that is why you haven't had colon cancer screening, there are non-invasive tests that you can do. And here are those options. The first is a stool-based test. There is something called a FIT test, which is fecal immunochemical test. This detects human hemoglobin in the stool. It's simple. You have to do it every year. There's no dietary restrictions, and it's very inexpensive. So if cost is a factor and, prep and all the things that go into it, this is the simplest screening test you can do. Its sensitivity for cancer ranges from 70 to 75%. Its specificity is 95%. So it is not the most sensitive of the test. And this is one of the reasons it has to be done annually. Cons, has to be done annually, and it does not detect for polyps. It's looking for blood in the stool, and blood hemoglobin is a proxy for there likely being a cancer. So it's a great option, however, if someone wants to do a simple annual test with very little prep. The next stool test is Cologuard. This is a stool DNA test. The difference is it detects both blood and abnormal DNA that is shed from precancerous polyps or cancers in the colon. This can be done every 3 years. It is more sensitive than the FIT test. Its sensitivity is about 92%. Its specificity is 87 to 90%, so just slightly less specific. But it does detect polyps more than the FIT test. I'm going to explain sensitivity and specificity. Sensitivity is how good it is at picking up. So if you're looking for colon cancer and you have 100 cases and all 100 of them have colon cancer, how many of those cases of colon cancer is your test going to pick up? So what this is saying that 92 out of the 100 cases that have cancer, this is going to pick up. Specificity is saying if it detects something, what is the likelihood of the thing that it detects is actually cancer? So when you have a test, and especially a screening test, you really want it to be highly sensitive. Highly sensitive tests are more likely going to have more false positives. So that means that you're not going to be quite as specific. So that means that you might have a positive finding that is not cancer. So the perfect test is going to be both highly sensitive and highly specific. So when you're hearing those kind of terms, that's what we're thinking about. But a screening tool at minimum should be highly sensitive, okay? So the sensitivity for the Cologuard is 92%. The specificity is 87 to 90%, still pretty good. The cons of this test, because it's a little less specific, you're going to have more false positives, and it's also a little bit more expensive. It is covered by insurance, but if you don't have insurance and you're trying to look for a cost-effective option, then the FIT test is going to be a better choice. Any positive stool test, just like the FIT requires a colonoscopy as the next step, though. Now, there are other tests now that involve blood. There is something called SHIELD, and this is provided by Guardian Health. This is a relatively new development. This looks for circulating tumor DNA in your bloodstream. Now, you can actually look for circulating tumor DNA for a whole wide variety of cancers. Take another little brief episode, and maybe I'll do an expanded episode on it. We'll see. But the pros of this test is that it is a simple blood draw. You don't have to do a stool collection, and it's a good way to increase screening because a lot of people are already getting blood draws for other blood screening, and people tend to have less of an issue with getting that done. It has an 83% sensitivity for colon cancer and a specificity of 90%. It's about as specific as the FIT test, but it's less sensitive than either the Cologuard or the FIT test. One major limitation is it detects only about 13% of the advanced precancerous polyps. It is a decent test. It is pretty specific if it does detect the cancer, but it is not as good at detecting the polyps that we want to remove before they become cancer. On the positive side, Medicare does cover it, and private insurance is slowly catching up. So it's not a bad test, but again, doing no screening, it is better to do some form of screening than no screening at all, is really kind of my takeaway there. So how do you choose the right test for you? First thing, the best colon cancer screening test is the one that actually gets done. So if you're avoiding colon cancer screening, the one that you do is going to be the best one. If you are high risk, or you're someone who has already had a positive finding on a colonoscopy, then colonoscopy is going to be the best option for you, okay? If you haven't had any colon cancer screening, you're not sure about your risk, you can really choose from Cologuard, FIT, or blood test. And really at that point, it really comes down to cost and your risk avoidance. A good middle option still at this point is Cologuard. Cologuard actually didn't mention this, but Cologuard also came out with their own version of a blood test. So I didn't provide those details on here. I'll maybe include it in the show notes. But so that is another option. The FIT test is another simple option. It's a little less convenient because you have to do it every year. And the blood test is something that has potential for those who are trying to avoid any of the other options. So you have at least two options for blood testing now. Both Cologuard and Shields provide a blood test that you can use for colon cancer screening. So if you are over the age of 45 and you haven't been screened yet, this is your sign. Go get it done. Colon cancer screening saves lives. Talk to your physician about your options and discuss which option makes the most sense for you, because prevention isn't just medicine, it is a lifestyle choice. All right, thanks for listening to the Lifestyle MD podcast. I hope you found this helpful. Come back next time for our next Soundbite.
Thanks for tuning in to the Lifestyle MD podcast. Remember, your health is in your hands. Stay informed, stay healthy.